Good afternoon. Welcome to the continuation of Grenzebach, Glier & Associates webinar series. GGNA is committed to providing our clients with exclusive content and resources in philanthropic management with a particular focus on best practices and building capacity. Thank you for joining us today. We hope that everyone continues to stay safe and healthy during this crisis. Today's webinar topic is focused on our work in philanthropic analytics. We will be discussing how to best leverage your DonorScape results. I'm Paul Mateo, Vice President, Client Solutions, and I'm joined today by Daniela Broderick, Consulting Associate, who serves in our executive, healthcare and academic medicine, and advanced analytics practices. Daniela brings to the firm more than 12 years of experience in higher education. Prior to joining the firm, Daniela served as a chair of fine arts at Joliet Junior College, where she was a tenured professor of music. Daniela holds an MBA from the University of Chicago Booth School of Business and a doctorate in musical arts in piano performance and literature from the University of Illinois Urbana-Champaign. Daniela will present 10 best practices in prospect management and how to maximize the results of our DonorScape wealth and philanthropic analysis. We will, of course, have time to answer questions following our presentation. Please do pose your questions through the chat option in the Zoom toolbar at the bottom of your screen. You may pose your questions at any time during this webinar. With that said, I'll turn the program now to Daniela.
Thank you, Paul. Good afternoon, everyone. Thank you for joining us this Friday for a webinar on how to leverage your DonorScape results. Some of you attending the webinar today are clients and either have the DonorScape subscription or have been engaged with us in predictive modeling, major gift portfolio analysis, or all of the above as part of a campaign readiness study or program review. Some of you are not DonorScape clients yet. Given the very specific terminology I'll be using during the presentation, I'll quickly explain the value proposition of DonorScape and define some of our terminology. Since GGNA began screening constituent records more than 30 years ago, the firm has screened more than 600 million constituents records across 5,000 nonprofit organizations. This experience has allowed us to develop, refine, and deliver a methodology to our clients that is a trusted and tested way of thinking about how wealth factors can be used in deciding who to solicit and for how much. Once a client sends us a data file with its constituent records, DonorScape identifies who each prospect is using rigorous match logic to be certain. As data accuracy will always pose a challenge in the evaluation and matching of individuals to wealth assets, DonorScape provides clients with the capability to assess match data accuracy at 4 different levels within the individual or asset data points: simple, possible, near, and exact. DonorScape then gathers a broad range of external data about each person from a variety of data sources and uses that data to estimate the known wealth of each individual. DonorScape uses both this externally gathered data and the past-giving, demographic, and engagement data provided by the client to build a model of likelihood to give at a specific gift capacity rating level for each individual. So the gift capacity rating is a dollar value estimate defined as an individual's capacity to make a gift over 5 years to his or her favorite organization. Likelihood to give is based on a blend of wealth, relationship, and historical giving data. Once ranked by total score, the records are assigned a likelihood to give rating based on a fixed percentage of the entire file. So likelihood to give ratings are relative. Ratings A through C comprise the top 5% of households in terms of their likelihood to give to your organization at the rated level. DonorScape provides a roadmap for thoughtful and aggressive prospect solicitation which includes a rigorous process of restructuring or realigning prospect portfolios and firm guidance around the right ask amount for that institution. DonorScape results can also provide evidence to strengthen the argument for where organizations' fundraising investments should be made. I want to also mention that we can not only provide gift capacity ratings and likelihood to give, but we also offer planned and annual giving ratings should the client choose to broaden the analysis of its constituent records. With the DonorScape Philanthropy screening, organizations have the opportunity to discover new prospects with capacity to give. It will give organizations the opportunity to understand the capacity of individual prospects and overall prospect pool, and will give organizations the opportunity to focus its resources on their most valuable prospects. Today, we're going to target this area and give you some ideas around how you can focus on your best prospects when you have limited frontline fundraising staff. If you're not a DonorScape client yet, please contact us for a conversation and a demonstration of the platform and of the different products we offer, including predictive modeling, major gift portfolio analysis. We'll provide you with our contact information at the end of the presentation. So our conversation today will be geared towards the focusing of fundraising resources on a client's best prospects within their constituent data. More specifically, we'll focus on those organizations who might not have a very well-established prospect management function yet, although most of the best practices we are going to discuss are applicable to any size organization, including those with well-established prospect management and research functions. A quick note about prospect research. Although intricately connected with prospect management, that will be a topic for a different webinar given our time limitations. I will present this information in a somewhat chronological and step-by-step fashion, but any of these best practices can be used individually. As Paul mentioned, please feel free to type your questions on the chat box, and we'll address as many as we can at the end of the presentation. If we don't have time to address every question, we'll follow up via email. Well, let's get started. When you receive your DonorScape results, you see it on the DonorScape platform where you can filter, search, pull lists, or you're going to receive a report in which you see the data in aggregate and in many different configurations. If you receive the report, of course, you still have access to the DonorScape platform. This is one of the data tables you'll find on the report, and it will be the focus of our conversation today. This data shows us not only how many households you have in your database capable of giving at a specific range within a period of 5 years, that's the gift capacity rating, but also shows you the likelihood to give at their rated capacity level. Additionally, this table is showing you who is currently assigned to a frontline fundraiser if the client provides us with that data point, and who is currently unassigned. Here's the assigned population, unassigned population. This is a great way to see a snapshot of your constituent records just by the numbers and gives you a better understanding regarding your best prospects, and if you're in fact paying attention to them. In this case here, there are 284 assigned households who are not capable of gifts above $100,000, which happens to be the major gift threshold for this hypothetical client. However, there are 255 households who are capable of making gifts at that level and who also have a higher likelihood to give to the organization. Well, when clients see this table and have a few moments to absorb, they ask us, and sometimes themselves, some questions. Do any of these sound familiar to you? We have all of these ratings. Now, how can we and our gift officers put them to good use? We have more prospects than we can effectively handle right now. Are our gift officers talking to our best major gift prospects? Let's go right into our 10 best practices to help you tackle some of these questions. First of all, you need to make sure someone is managing the process. That person could be the prospect manager or managers if you have that function. But as you know, many organizations might not have someone dedicated to that specific function. So it could be that the prospect researcher has taken ownership of that process by the nature of his or her job. It could be someone from the leadership of the organization, like an executive director or the chief philanthropy officer, or you might establish a committee. Either way, a person or a group will be responsible and accountable for rolling out the policies, procedures, timing, and making decisions regarding the assignment of prospects. Another option is to hire a consultant who in partnership with the committee or the person responsible for the process will help the organization strategize around these new assignments, moves management reports, and so forth. This consultant would also have regular check-ins with frontline fundraisers. This might be a cost-effective alternative to hiring a prospect manager. Once you know who is going to manage the process, the organization must think big picture first. Based on the aggregate data, take the opportunity to reset. Here again is the aggregate data that I showed you in the beginning. For example, based on the number of prospects you have at a certain level, should you rethink your major gifts threshold? Should you formalize a leadership annual giving program based on the number of prospects at a certain level? This will be a great time to think through some of these issues, but also be able to justify some of these potential changes based on hard data. These are not decisions to be made solely based on the DonorScape data, but certainly this data will give you another factor to take into consideration when making such decisions. It will be helpful to have the right framework to start a process of newly discovered prospect assignment. Also, take the opportunity to review and change metrics if necessary. Our portfolio size is in line with best practices. Do we have moves managed policies and metrics in place, which will allow us to maximize this effort? For example, timing in each stage, composition of each stage, number of visits per year, number of major gift proposals per year, etc. Again, if adjustments need to be made, this is probably the time. This is an example of prospect staging, including the timing recommended in each stage. This might not be right for every organization, but whatever is right for yours needs to be clearly communicated and documented. Once those first steps are in place, move on to the specifics. Start with the assigned prospects. Again, this is the top of that table that I showed you in the beginning. Those are currently assigned to frontline fundraisers. Start by reviewing the D and E prospects, those with low likelihood to give, who are assigned to the gift officers at the moment, especially those with low gift capacity rating. Move assigned prospects up and down the pipeline accordingly. Each gift officer should look at the prospects they have assigned who fall into this category and have a clear reason regarding why they should keep that prospect assigned. Perhaps there's a very good reason that makes that prospect worthwhile. Otherwise, that prospect should be probably moved to annual giving in order to open up space for other high priority prospects. The goal is to get portfolios ready for additional assignments. Start assigning the newly discovered prospects, those shown as currently unassigned. Start with the high priority, unassigned, those with likelihood to give from A through C and gift capacity rating of 100,000 plus, or those with gift capacity ratings at your organization's major gift threshold. At this moment, I would like to provide a quick word about verifying the DonorScape data. We recommend further verification and validation of the data after a first call or visit with a prospect, especially if you're starting with the near and exact match accuracy settings of DonorScape, which I explained in the beginning. Too much research before that will slow down the process a little bit too much, especially for a small organization. And a lot of time could be spent on someone that will be very quickly disqualified by a gift officer. However, once the first visit or call has taken place, verification and additional research should occur. When you start working on the unassigned prospects, you might encounter a few different scenarios. For example, you can have a situation in which the screening unveils a large number of high priority prospects, and your organization doesn't have the bandwidth to absorb all of those in portfolios. In that situation, consider dividing the high priority unassigned prospects into groups or categories. You need to decide what those categories will look like based on the number of frontline fundraisers you have. The first would be your highest value prospects. You might have the bandwidth to start with the A's and B's, starting at a certain gift capacity rating level, or you might take on the low-hanging fruit. That might be all of your prospects rated A first, basically the tip of the top of your pyramid. Category 2 will be the next tier based on whatever you decided Category 1 will be. This category should be treated as a group. You can invite them to important events, send special correspondence, conduct a survey to gauge their interest in any other additional engagement strategies you might have. Individual households from this group can move to assignment once Category 1 prospects start moving through the pipeline. So in this first case scenario, a hypothetical organization had too many high priority unassigned prospects. Let's say that on the second scenario, the screening identified a small number of high priority unassigned prospects. In this case, we recommend that the organization makes a more concerted effort with what we call long-term prospects, those who have high capacity but lower likelihood to give. So they're D's and E's, but they have high capacity. This effort could start with initiatives similar to those I mentioned for the Category 2 of high priority prospects, invitation for events, special correspondence, or surveys. The unassigned long-term prospects can be moved to portfolios for qualification, but the process of qualification, and especially getting these prospects from cultivation to solicitation, might take longer than the A's, B's, and C's. For those who engaged us to provide the planned and annual giving rating as well, you can pull blended lists from the DonorScape platform. This would be useful to any scenario if you have too many, too few, or just the right number of high priority prospects. You have a number of prospects with excellent ratings in major, planned, and annual giving. These prospects should be approached with a blended gift strategy and might be coded differently when assigned to a gift officer. You don't want to leave money at the table because you neglected to notice that your major gift prospect has a primary planned giving rating, for example, and you didn't start that conversation. This list can be filtered on the DonorScape platform, and you can filter in any way you think it would be most helpful to your organization. For example, you can pick likelihood from A through C, gift capacity rating at 100,000 plus if that's your major gift threshold, planned gift rating primary, and your giving rating $5,000 or more. Another example, if you have a major gift threshold, would be to keep the likelihood from A through C, gift capacity ratings of 25,000 or more. Planned giving ratings, you can expand that not only from primary and secondary, and annual giving rating of 2,500 or more. So you have realigned portfolios and assigned new prospects. So now what? Well, if you have not done this yet, you should establish a regular cadence of meetings to maintain momentum. Individual pipeline meetings should happen monthly and can be designed for gift officers to review the advanced stage prospect pipeline. We recommend a rotation of stages each month. For example, month 1 for qualification, 2 for cultivation, 3 for solicitation, and 4 for stewardship. Start all over again on month 5 and so on. These meetings are forward-looking and focused on next steps and milestones. And the rotation will ensure that the early stages are not neglected, especially qualification. Quarterly progress review meetings can be used to review the status of each gift officer's assigned prospect portfolio in relation to their annual goals. And finally, prospect strategy meetings should be held as needed. These could be dedicated one-on-one or group meetings where detailed strategies are developed or revised. Finally, purge once a year. It's okay to carefully and thoughtfully disqualify. It is okay to move prospects to annual giving. And it's okay to move donors into permanent stewardship. These are some of the best practices that I had to share with you today. I hope that you found something that can be useful to your organization during this time, even if you have received your wealth and philanthropic screening a while ago. With that, we are going to move into questions.
Hi, Daniela. We have a few questions from the audience. The first question was, how do we gain buy-in from the different stakeholders across the organization around this particular process? Do you have any advice for our clients?
Sure. Well, that's a great question. I believe that one of the first steps is to socialize the data or the report early on. And you know what the end result could be if the organization takes action based on that data. So for instance, it will be important for frontline fundraisers to know that they will not have to purge the prospects that were rated low priority, but that they will be asked to review them carefully and you know, see if there are any reasons to keep them engaged. Letting them know that the intention is really not to, the intention is to augment, but not to diminish the total value of their portfolios. So if buy-in seems unlikely from any number of reasons, perhaps moving to the ownership of the process to a committee structure, as I mentioned in the beginning, could make sense. And the other part of it is that sometimes you need to get buy-in from leadership if additional investments are to be made. So for example, if you're thinking about hiring a prospect manager or adding additional frontline fundraisers. So again, demonstrating the return on investment here, the wealth screening data, I think will be key and very helpful.
Daniela, one question from the audience. They're actually requesting to repeat best practice number 7. Would you be able to go back and review that particular best practice?
Of course. Sorry, Prezi is a little difficult to get right into. Yep, okay. So start engaging with long-term prospects. Do you have a specific question or you just want me to repeat the advice?
Yeah, I think this one went rather quickly. So if we could just review number 7 again would be great.
Sure, yeah. So the long-term prospects are these prospects that have high capacity. So in this case right here, so whatever it is, the high capacity for your organization. In this case, we're thinking 100,000 or more. However, when we look here at the likelihood rating, they are less likely to give based on this. So the idea, if they are already assigned, right, is that you think of them as long-term because it might take much longer to cultivate them, to make them ready from a cultivation stage to a solicitation stage, because they are not as warm to the organization. Here you have the unassigned, and you have a group that looks very much like this group that is already assigned. So the idea, let's say if you have already a good number of unassigned, there are here on the A's, B's, and C's, you don't have to worry so much about that. But if your results really come back and you don't have a good number here, and you're looking for new prospects, these right here, if you have a good number, that would be an area that you might explore. So they would be treated the same way as you treat those. I think that you could potentially already assign them to gift officers that there's space in their portfolios so that they can start the qualification process. But what I mentioned was that the qualification process is going to take probably longer, even to get a response on a meeting or accept a meeting and so forth. And then that once you get that, and if they are qualified into your portfolios, it might take much longer then to get them from cultivation to solicitation.
Thank you, Daniela.
Yeah.
a few more questions.
Sure.
Client is asking what they should do with the unassigned high priority prospects if they are unassigned for a very specific reason.
Oh, sure. Well, so perhaps they have already been disqualified. When you look at the list of names, you think, well, this prospect should be a D or an E. That is very well possible. It would be helpful to mark them as disqualified on the database so that they might not be included in future wealth screenings if you really would like to exclude these individuals. If you don't want to exclude these individuals so that you keep, tabs on them, they will appear probably, the next time over as being high priority. However, we recommend that you have, that list of those who have been disqualified, especially those with high gift capacity. But then you can look at that list once a year. And unless there is a do not contact flag, these prospects could be treated the same way as you're treating these long-term unassigned prospects or assigned prospects, with the same kind of engagement techniques that we talked about. Even from a certain distance, sending interesting correspondence from the organization. If you're doing a survey, include them. Those kinds of things, because circumstances change, and if you continue to update them about your organization, something could catch their attention or interest, and you might have an opening in the future. So it's something to think about how you want to engage with them. But then, yes, probably you are not going to assign them to gift officers at that point. But treat them, this way, engaging with them and seeing if that might lead to something in the future.
Wonderful. Another question, Danielle, from the group is, how much access should the clients give to their gift officers or their frontline staff?
Okay. So this is not a one-size-fits-all answer. This data, so when you do the study, or if you have the subscription, this data gets imported into your database. So that being Dana, Razor's Edge, and so forth. So the gift officers will have access to it that way. Some organizations choose to give DonorScape access sometimes on a reading-only basis to gift officers. And that might be helpful once new assignments have been made. Sometimes, if all of the gift officers have access, they will all want the quote-unquote best prospects. So that is, it can be a little bit tricky. So it is certainly a question we receive from organizations all the time. And we work through this decision with them based on how they will approach this assignment of new prospects. So, as we are getting ready to report the data, getting ready to do the training, we have the conversation with the, whoever, is our client at the time, and thinking, okay, does this make sense now? If so, how we are going to do it? And if it doesn't, why it doesn't make sense? And if it will make sense in the future, how we're going to do it. So in a nutshell, I would really say it's on a case-by-case basis.
Thank you, Daniela. I'll answer a few questions from the audience as well. There was one question regarding how often clients should rescreen donor and prospect populations. And I'll speak in generalities. Generally speaking, in terms of wealth data, in terms of their capacity and their indicators of capability to give, we would suggest that clients don't go longer than annually to have this data refreshed or rescreened, if you will, especially now in times of economic change and things of that nature. We would recommend that be more frequent. and many of our clients can do that automatically over the course of their subscription with no cost. In terms of the predictive analytics, their likelihood to give, typically these the shelf life of predictive modeling ratings and likelihood to give ratings are typically no more than 3 years. Depending on where our clients are in a particular campaign setting or sustained fundraising effort, we might suggest that that be reevaluated prior to the start or the finish of a campaign. And certainly there would be reasons to do that in the middle of one. So screen often and screen regularly would be our general guidance. It looks like we have several other questions, but we will likely address those offline. Some of these are very specific to your institution, and we will reach out to you directly. I want to thank Daniela for her presentation and insights today. I would like to thank all of our attendees for engaging with us in sessions like these. We hope that this presentation will be valuable to you in your work. Please join us for our next webinar, part of our continuing series in fundraising in a public health crisis, on Monday, April 13th at 11:30 a.m. Central Time, where the topic will be fundraising for North Shore University Health System's response to COVID-19. This webinar will feature guest speaker Elizabeth Middleton, Assistant Vice President, Donor Development at North Shore University Health System Foundation, in conversation with Jeff Nierhoos, Senior Vice President in GGNA's Academic Medicine and Healthcare Practice. We hope that you will join us. Thank you again for joining us on this session, and we hope that you have a wonderful weekend.